Hi, Dolly. It's good to see you. Please have a seat. So, Dolly, you've been diagnosed with attention deficit hyperactivity disorder, which is also called ADHD, and you were recently prescribed Concentra. Is that correct? Mm-hmm. Well, how do you feel about that? Right. Well, that's understandable. And I hear a lot of people say some variety of what you just told me. The thing is, this is very common, and I just want to let you know that you're not alone. Now, as I'm sure your psychiatrist went over a lot of this with you, but as your social worker, the purpose of us meeting today is for many reasons. So, one, I want to make sure that you understand the medication that you're taking. Two, what this can do for you. Three, what the possible side effects are to look for. Four, how I will be supporting you as you begin to take this medication. And last but not least, I also want to know how you're feeling. So please, at any time, stop me if you don't understand a word or what I'm saying. Feel free to ask me anything, okay? So you're probably asking yourself, what is ADHD? Well, ADHD is very common, and it affects children and adults all the same. No one is immune. In fact, no one even knows why some people get ADHD in the first place. But what people do know is that ADHD affects the chemicals in your brain. So if you can, try to think about your brain for a second. Try to go inside your head if you can, and basically just like if you can, just imagine your brain not being able to talk to each other, the different parts of your brain not being able to talk to one another. And remember how you told me that you have trouble sitting for long periods of time and concentrating for long periods of time? Right. Well, that's why that is. It's because your brain's not talking properly to each other. So that's where the Concentra comes in. And when you take your medicine, it looks to reconnect the chemicals in your brain to talk to each other properly. So that's its primary job. Does all that make sense? I know it's a simplified version, but that's what is happening. Good. So, Concentra is a methylphenidate. What that means is a stimulant. It's designed to control your hyperactivity and allow you to sit still and concentrate. How does that sound? Now, you've been prescribed an 8 milligram dosage, which is the smallest dosage available. The reason for this is so we can see how you react to the medication. Now, it's important for you to know that these are extended release tablets, and you take them by swallowing them whole. So it says here you're supposed to take 1 tablet in the morning before breakfast. Extended release tablets also means that when you take them, the medicine is dispensed over a long period of time, rather than your body quickly absorbing the medicine into your bloodstream. It's important not to split the tablets for any reason. The reason for that is the medication can be distributed unequally into the tablet. And if you split the tablet, there's a chance you wouldn't get any of the active ingredients. So if you miss a dose in the morning, it's okay to take a pill as long as it's before 6 o'clock in the evening. Okay? So if it's after 6 o'clock, just skip it for that day. And lastly, you may want to consider avoiding alcohol with this drug, as alcohol can release the medication into your bloodstream at an accelerated rate. That's just something to be cautious about. Does all that make sense? Do you have any questions so far? Okay. Well, now, as with any medication, there are potential side effects. I'm sure you've taken medicines before that have had side effects. So this drug is no different. And what I want to do is I want to go over all of them with you so you can be aware if you are experiencing any of them. So the most common ones, and there's a lot of them, and I will give you this printout before you leave today so you have something to reference. I don't expect you to remember all of them right now. The most common side effects are stomach pain, loss of appetite, headaches, dry mouth, nausea, vomiting, insomnia, anxiety, dizziness, weight loss, irritability, vision problems, skin rash, numbness in your hands and feet, or uncontrollable sweating. Now, that doesn't mean that you're going to experience any of those, but they are some side effects that some people do experience. Now, there are also some very severe side effects, and these are the ones I want you to be really um, cautious about. So they are increased heartbeat, chest pain, bruising, and fevers. So if you experience any of those, please stop taking this medication immediately and let me and your psychiatrist know. Now, are you taking any medications currently? And before you answer that, that would include any over-the-counter medications, any supplements, any alternative medicines. Is there anything that I need to know about? No? Okay. Good. Well, if you do start to take something, please let me know and your psychiatrist know. Sometimes Concentra can react poorly with other drugs, even something as simple as the common cold medications that you buy off the shelf. Now, I'm also not sure if you're planning on becoming pregnant anytime in the near future, but if you are, please let me know. It's actually unknown how Concentra reacts with pregnancy, so it's something that we would need to be cautious about. And now, I'm not trying to scare you or make you nervous in any way. I just want you to be aware of what to look for. But we do need to monitor these things, and we need to be able to make adjustments accordingly if something arises. Now, the reason you've been prescribed this medication, though, is to actually help you. So just keep that in mind. So again, it's not to make you nervous about any of those things. And I'm here to help you as well. That's one of the reasons why I'm here too. We've been working together for a few months now, and we're going to continue to do so, just as we have in the past. So that won't change. What I want to know moving forward, though, is how you feel the medicine is working for you. Now, it's also really important to note that this medication is not an end-all be-all. So we're going to continue to do the same sort of work that we were doing before. We're going to continue to work on some of the coping skills around some of the issues that you've identified, such as not being able to sit still and concentrate. So we're going to continue to work on those, medicine or not. And we're also going to continue to look at some of the other difficulties that you identify as we proceed forward. And just as in the past, we're going to see how you can overcome them as well. How do you feel about all of this?